Hi, I'm Sue Goldstein, Program Coordinator at San Diego Sexual Medicine. What that really means is I'm in charge of the Educational Programs and Clinical Trials Unit at our facility. Part of what you would do when you come to San Diego Sexual Medicine or to any sexual health care facility would be getting educated on your particular problems, which is why I'm involved. When you come, you could expect to receive a biopsychosocial evaluation. What that means is you'd be evaluated by a sex therapist as well as a physician. It would be a conversation in the room with a sex therapist first, typically, then with the physician. After the conversation, based on your particular health problem, you would be brought into an exam room for a series of tests. It's hard for me to be specific on tests because there are quite a few, and it really depends on what your problems are. But of primary importance would be a vulvoscopy. When you go to the gynecologist, he puts a speculum into your vagina to examine inside. When you go to a sexual medicine physician, he's looking at the area covered by the speculum. That's the vulvar vestibule. We typically would take a photograph of that before treatment, and then throughout the course of your treatment, we would be able to take further photographs to document your improved health. Other tests might be sensitivity tests for hot, cold, and feelings, vibration. This would have to do with your nerves, what you're feeling. For some women, they can only feel their partners if they have true driving sex. We can discover that perhaps you have an issue with your nerves and you just have problems feeling, and that's why you need that kind of hard sex, which ultimately is giving you pain. We can do ultrasounds of your clitoral area if that's a problem. It really depends on what your particular problem is. We also do pH tests, which is a very benign, putting a piece of pH paper into your vagina. We can take swabs and look at the slides to see if you have any kind of bacteria. There are typical tests. We would, of course, take your blood pressure, your height and weight, all of these, because we want to follow you each time you come to make sure there are no major changes that way.